So when I was in first grade, that's when I first experienced a rash on my arm, and it was very itchy and very uncomfortable. So I went to my mom, who's a nurse practitioner, and she thought that it might be eczema, and we went to the doctor, and it was eczema. It was very hard to manage because I had to change many things in my life, like the detergents that I would use, the lotions that I would use, to make sure that they didn't have any perfumes or extra dyes in it. And sometimes I would scratch my skin so much to the point where it would bleed, and I would have to change the clothes that I would wear because I didn't want my eczema to be exposed if I didn't have Band-Aids.
Kaitlyn has atopic dermatitis, the most common form of eczema. It is a common skin condition, but is difficult to deal with, especially in skin of color. In this video, we'll talk about how people of color can get the right diagnosis and treatment to address their eczema. I am Dr. Luz Fonacier. I'm the president of the American College of Allergy, Asthma, and Immunology. Many people don't know that atopic dermatitis and allergies are actually related, that atopic dermatitis is often triggered by allergies and are treated by allergists. I am joined by my colleague, Dr. Cherie Zachary, who is also an allergist. She and Kaitlyn's mom, Patrice, are here to help us explain how eczema presents itself differently in skin of color and why it's so important to have your eczema diagnosed and managed early.
Eczema, also known as atopic dermatitis, can start anywhere on the body, but it often starts on the face, inside the elbows, and behind the knees. It usually starts in early childhood and progresses into adulthood. There are 18 million people in the United States with atopic dermatitis. Black children are twice as likely as white children to develop atopic dermatitis. People who live in cities also have an increased likelihood of developing atopic dermatitis, and that's probably due to an increased exposure to mold and dust. Now, we don't know what causes atopic dermatitis, but we do know there is a genetic predisposition. Patrice, I believe you have allergies in the family, is that correct?
Yes, that is correct. Kaitlyn's younger brother has asthma as well as seasonal allergies. I myself have asthma and was diagnosed in my 20s. In addition to that, my sister and my niece both have eczema.
Kaitlyn, what has been the most challenging part for you about having atopic dermatitis?
The hardest part about having eczema is the itch. It can happen all day and all night, and it sometimes can affect my sleep. And I have to buy different products and medications and moisturizers. And sometimes people would give me presents and gifts like body washes or lotions, and I couldn't use them because they would flare up my skin. So anytime I get a product, I have to look at what's in it and research about the things I don't know to see if it's good for soothing my skin.
Kaitlyn brings up a very good point. People with atopic dermatitis have much drier skin, and moisturization is a first line of treatment. In fact, many patients have to moisturize multiple times during the day. However, one has to be careful to find a product that will not cause an allergic reaction or actually irritate the skin.
As her mother, the hardest part is seeing Kaitlyn have the discoloration and the constant scratching that she does, because I know that this is a condition she must manage forever. In addition to that, I am also concerned at the fact that she can develop thinning of the skin from prolonged use of the topical steroids that she has used. And also, the prolonged use of steroids could cause other conditions from it being absorbed in her skin. I am also concerned at the fact that she is young and the type of comments that can be made to her because she looks different, particularly like ashiness or flaky skin, because eczema can appear differently in darker skin tone. And because of the variations of darker skin tone, it could look purple, brown, or even red.
For Black patients, the itching can be much more severe and more intense. And you can have different papular lesions all over the torso called papular eczema. You can also have inflammation around the hair follicle and kind of looks like a goosebump appearance. The skin tends to be drier and you tend to have dark circles around the eyes. And after all of the itching and rubbing and scratching, the skin can become thickened and you can have nodules that come on the arms or different parts of the body called prurigo nodularis. Now, when the skin heals, it often heals and has different colors. It may be lighter, it may be darker. And so you can kind of have this polka dot sort of appearance. It generally returns to normal, but it may take months. Now, being a parent of a child with atopic dermatitis is really difficult because you've got wet wraps and frequent bathing and frequent moisturizing, and you're applying topical steroids or other creams and trying to help with the itching and also trying to help with the social development. But the good news is there are new treatments available.
So you've heard the journey of Kaitlyn and Patrice on the different treatment that they have tried for atopic dermatitis. It doesn't matter what color of skin the patient has, the treatment is very similar. Moisturizers are the first line of therapy for treating atopic dermatitis. They work best if used frequently and on wet skin to prevent itching. Other treatment includes topical corticosteroids that target inflammation. Then you have non-steroidal topical medications, including topical immunomodulators, topical carcinoma inhibitors, and crisaborole, and they regulate the local immune response of the skin, help reduce the redness and itching of the inflamed skin. Antibiotics can be used to treat skin infections if there are any. Biologics are medications that target cells and pathways that cause inflammation. Talk to your doctor about which treatment they recommend and which treatment both of you think will be best for you. Our organizations are looking to educate the public and healthcare providers so that they can more easily recognize eczema in skin of color. We are also looking for ways to make sure that patients have access to good specialists and to effective treatments.